Hi guys, it's Dr. Obadia. Dr. Schwartz asked me to make a quick Camtasia for you, just kind of giving you some practical advice as to how to maybe conduct yourselves out there as a third-year medical student and fourth-year medical student. I'm calling this How to Be a Cool Third Year. I'm going to be looking at my list of topics I want to address as I go. So I basically wrote down the things that as an attending, like to see in a student. And I also asked some of the other faculty here to weigh in, and the other clinicians here at Soma to weigh in and add anything to my list that they could think of as well. So I hope this advice helps you out as you go out on your rotations. Number one, be on time. Call the week before. Call the office that you're going to the week before and find out how to get there. Plans for the day. What time does your attending start their day? Do they start in the hospital? Do they round on patients before they see patients in the office? Get to know the system a little bit. Usually office staff is very happy to help you do that. Learn how the office works. Let's see. When you're in the hospital, be earlier than the attending. You have to write your note first. And even if that means that you're getting up at 5 o'clock in the morning and going in and writing your notes at 5 a.m., your note has to be written before the attending and the intern and resident if you're on a team. So be mindful of that. You've got to do it. You don't have a choice. Know your patients. Know what happened overnight. Did they get any labs? Did any consultants come see the patient? Read the chart. Make sure you know any test results, any radiologic studies that came back. Track things down. Know everything. Try to know everything before your attending comes in. And even if that means you're telling your attending, this is pending. This is the results aren't back yet. You know that information before you're attending, and it's going to look. You're really going to shine. Let's see, be kind and helpful to everybody you interact with in the hospital. You will be surprised at how often attendings will come and ask the nurses, hey, what do you guys think of the student? Or the residents, the interns, asking staff, what do you think of the student? We're thinking of having them come as a resident. Did they treat you nicely? You'll be really surprised at how that input weighs in on the decision whether or not you're going to be chosen. So even the janitors. I remember as an attending at Good Sam, I would even ask the cafeteria staff sometimes, how is this student towards you? It matters. It shows, okay? Not just to be super polite and absolutely respectful to your attending. I've seen many students make that mistake. They're absolutely a gem when it comes to their attending, but to everybody else, they are think that maybe they're above them, and it does not work out well for that student. I've seen it time and time again. So I know you guys are all so nice people. You would never do that, but just a word of caution. Let's see. In an emergency situation, jump in. You've heard me say it in med skills before. Do not be a wallflower. Jump in. Try to be helpful. You will be surprised at what you will be allowed to do. Try not to get in the way. It's a fine line you're walking, but be helpful. Be there. If somebody needs you to do something, you jump in and do it. Ask questions later, though. That's not the time when you're trying to do an emergency intubation. Your attending's trying to do an emergency intubation. It's not the time for you to ask your question about the proper techniques in intubation in general. Save that for later. Definitely do get a chance to debrief with your attending after emergencies, and your attending a lot of times will sit down with you and show you how that emergency played out and what could have been done differently, or why they did what they did. It's a really helpful thing to do. Let's see. Always ask questions, though. That is your job as a student. Your job is to ask questions and learn. And so always ask questions, but sometimes know the timing of your question. Is it appropriate to ask your question while you're in the patient room with the attending, or should you hold off? Use your best judgment. And if you think you're not sure whether you should bring something up in front of the patient, best not to. Hold off and then ask later, okay? Use your best judgment. Let's see. Do not check text or emails while you're in a patient room, while your attending's talking to you, while you're rounding with your attending. That's your personal business. You need to do that in private, even if it means you're doing that when you're in the restroom breaks, okay? it's a little confusing, difficult, because a lot of our smartphones have these medical apps, and we want to look up something, and we may want to look it up in a patient room. If your attending's talking about a medication that the patient's taking, you might want to quickly look it up so you know what they're talking about. Let your attending know, ask them if it's okay, him or her, if it's okay that you do that in the patient room before you do that. That way they'll know you're not just texting, that you are actually maybe looking something up, okay? When we used to have just books in our pockets, we would, look up everything in these mini books. It was very clear that that's what we were doing, but with the phone, it's not so clear. Let's see. Write down 3 things each day that you've seen that you don't understand, or you may want to look into further. You didn't understand the word, the medication. At least 3 things a day. Write them down in a little note in your pocket. That night, take those 3 things and really read about them, learn about them. If you do that every day that you're on the rotations, your knowledge base is going to increase tremendously. It's a great way to learn because you're correlating the information with something you saw that day. Let's see. Be careful when using humor. Be careful when you're joking around with hospital staff, your attending, and even patients. Use your best judgment. If you're going to say a joke or a wisecrack, run it through your head first. Don't just blurt it out. If it's appropriate, go ahead. But if not, then don't say it, okay? If you're not sure, don't say it. Let's see. Use your free time wisely. As a student, you are going to have free time. That's just the way it goes. As far as you're attending, seeing patients in the office, they say, okay, I'm going to see this patient on my own. They don't want a student in, or I'm going to meet back with you at 2 o'clock. I've got to go do a meeting. You will have some downtime. Use that time, whether you're in the hospital or in the office, to learn as much as you can about being a doctor. How does this office staff work? Go up to the front desk, ask them to walk you through it when a patient calls for an appointment. If you're in the hospital, use that time to go down to x-ray, check out how they're doing MRIs. Most people in hospitals are very happy to talk to you and teach you something if they can. If you see somebody, respiratory therapist working with a ventilator in the ICU, go ask them to show you what they're doing. They'll be more than 75% of the time, they'll be very happy, if they're not overwhelmingly busy, to talk with you and teach you. So it's a great way to learn more and more information. Let's see. Know the dress code and follow the dress code. So when you call the office the week before to find out where it is and what time you start, say, hey, what is appropriate for me to wear? Scrubs are not often appropriate to wear in an office setting, even if your attending does. Even in the hospital, if your residents and interns are allowed to wear scrubs, you may not be allowed to as a student. So find these things out beforehand. I promise you it's better to know beforehand. Let's see. Note, your notes should always be thorough. You're a 3rd-year student, you're a 4th-year student. Your note should be the most thorough one in the chart. Don't be fooled that, oh, my attending writes really short notes. It's okay if I do too. It's not okay if you do too. They are expecting you to write a thorough note. Part of the reason they don't have to write a long note is because you've already written such a thorough, cool, great note. So don't make that mistake. Also, when you're writing notes, take some time to look through the chart at other people's notes. That is one of the best ways you can learn how to write a better note. You can take what elements you like from a certain note that looked really well organized to you. That person really spelled out what was going on in their assessment. I like the way they did that. I like how they arranged their labs. These are things that you can learn from and pick up and improve your notes. So use that time to go through the chart a little bit. Let's see, same with physical exam. Your physical exam should be thorough every single time. It may be a focused physical exam, but do a thorough one. You'll see your attendings do a very cursory exam sometimes. It's okay because they are the attending. They've maybe, if you're on a cardiology rotation, they've listened to 1 million hearts. They're not demonstrating every skill that you learned in med skills as they do at their exam. But when it comes your turn to examine the patient, do a thorough exam. That's how you see as many normals as you can and see as many abnormals as you can. So don't make the mistake of skipping and doing a shoddy exam. Okay? Another thing, respect your attending. Don't disagree with your attending in front of patients or other house staff. It's not going to end well for you. Don't do it. it's okay to disagree with your attending and encourage to have discussion about treatment plans or ways of approaching diagnoses. Have that discussion in private. Save it for later. Do not do that in front of house staff or nurses, patients. It's not appropriate. Let's see. Ask what you are to do in case you have an emergency come up. Know the plan beforehand, before the week before when you call to see where the place is and the schedule. Ask what to do in case of an emergency. Who should be notified. If you're in the hospital, you need to know who's going to take over your patients. As a third year and fourth year, you're going to be responsible for certain patients with your interns and residents. Just know beforehand what to do in case of an emergency. And remember, only use the excuse not to be there when there is a true emergency. A lot of times students make the mistake of thinking, I don't need to show up. I mean, I'm only the student. Nobody's going to notice. They might even be happy that I'm not there. That's not the case. Everybody notices, and it will reflect very poorly on your evaluation. If you're not there, it truly should be because of an emergency. Otherwise, you need to be there. Be where you say you're going to be there on time, okay? Let's see. Know the expectations of the rotation before you start or the morning of. Know which patients you're supposed to round on, which ones you'll be assigned. Ask your residents and interns what they want you to have ready every day. What you're responsible for. Nobody's going to fault you for asking that, and they're probably going to think, wow, the student is really conscientious. This is a great student, because a lot of students, are slackers, and so you will really shine if you are showing that you need to know what you want to know what you need to do to make it a great rotation, make a good impression. Let's see, and even if you're in a rotation where you're really sure you're not going to do that specialty, or you don't want to be at this hospital, it does matter. You would be surprised at what matters and when you may need a letter of recommendation. Always show your best self. Let's see. Be aggressive about tracking down test results. If it's not in the chart, go find it. Even if you find out it hasn't been done yet, at least you know. Don't just say, "Oh, it wasn't in the chart. I don't know. I can't find it." Do your very best to track things down. That's your job as a medical student. When you are seeing patients in the morning, when you're the first one there rounding on the patient, which you will be the first one there because you're the student, wake up the patient. Don't be afraid to wake the patient up. You have to. The nurses will be upset with you. Oh, they had a rough night. They didn't sleep well. Now you're going to wake them up at 5 a.m., 6 a.m. Your job is to get that exam and see how they're feeling, and you have to wake up the patient. So don't be afraid to do that. That's the way it is. Another thing, if you haven't looked on physical exam, if you haven't found the test result, do not try to make something up. Just say, I didn't look, I'm not sure, I will go back and do that. Be as honest as you can. Don't fake it. Do not lie. It never ends well, okay? If you didn't do it, don't say that you did. It's okay. Just go back and do it. Another thing, no perfumes, no heavy colognes. When you're in seeing patients, a lot of patients have bad reactions to heavy scents, especially pulmonary patients. So keep that in mind. Save those for after work. Make sure your fingernails are well groomed. That does make a big difference. Short fingernails for physicians is pretty much, mandatory in order to do a good physical exam. Keep it in mind. Another thing, don't bring personal issues to work. You are a professional. Even though you are a student, you're still a professional. Leave the personal issues at home. Do not bring them to work. Even personal medical issues in which you might think that it'd be okay because you could ask your attending, personal medical issues, best to leave it at home, okay? Remember, you are paving the way for future students, your fellow colleagues, to get rotations. If you do a good job, chances are those people that you're rotating with are going to say, oh, we love that SOMA student. I love taking SOMA students. They're so conscientious. They do a good job every time. If one student does a poor job, then that reflects poorly on the whole school. And say you're at Good Sam rotating internal medicine clinic, and and you don't do a good job, then the next time a student from Soma wants to do that rotation, there's a prejudice against that student, and the attendings may say, oh, we don't like students from there. We really don't want to take them. So remember, you are paving the way for future students to come and rotate through. So always do a good job, not only for yourself, but for your colleagues, okay? And let's see. I think I've hit everything I wanted to hit. If I can think of anything else, I'll do another Camtasia. I know you guys are all going to be great out there, and I hope this helps. And take good care.